Why vaccines are important? Because it's one of the most effective ways of preventing disease. Some diseases that can be prevented and some diseases that have been eradicated. So to make sure that that continues being not a burden or a threat. But for patients that have rheumatoid arthritis, it's particularly important because the risk of certain infections in these patients is higher than in the general population. So that's from the perspective of the patient. It's important because if I get the vaccines, I will be able to have less risk of having severe disease or contracting certain infections. From the point of view of the people that live with a patient with rheumatoid arthritis, there's a lot of thoughts that is a way to protect my mom or my sister who has rheumatoid arthritis. So there is an aspect that it's relevant there too. But there's also an aspect that it's really important for society, because if we get vaccines and we are able to avoid to have an infection, we have less risks of being hospitalized, we have less risks of missing work, we have less risk of having a disruption in our family. So really being vaccinated not only has a positive impact for the individual, but also for the society. Now in 2023, we understand that vaccines are part of the care that we should provide to patients that have rheumatoid arthritis. In the same way that we treat the disease, we need to prevent consequences that are associated with the disease itself or with the treatments that we prescribe for treating rheumatoid arthritis. This is something that we have learned as rheumatologists through the last several years, right? We are using, for example, small molecules, JAK-STAT inhibitors that can increase the risk of zoster. So we do have a way in which we can prevent that. So we need to make sure that we do that. We know that patients that have rheumatoid arthritis have an increased risk of respiratory infections, and we do know that we have very effective vaccines to treat these conditions. So as part of the treatment, it's as important to say, you know what, we are going to work together to control your disease, but also we're going to work together to prevent things that can come with the disease or with the treatment that we are discussing.